I was 17 years old when I was diagnosed, and it was a weird time because I just felt a lump, and that's all. And I went to my grandfather, who's a doctor, and I just asked him, why do I have a lump? And he was like, oh, everyone's body's different, don't worry about it. And I just like, Grandpa, why do I have a lump in my stomach? And he just like tapped around a little bit, and then he sent me into the ER, and they knew it was bad right away, and I got diagnosed pretty fast, and but they didn't believe I had this cancer. They had to retest it 3 times because it's such a rare cancer for teenagers to have. It's very common in children. I mean, it was one of those things where I just sort of, okay, I'm just gonna fight it really hard and beat this. And so I did 7 rounds of really high-dose chemotherapy. I was in the hospital for basically my entire senior year of high school during chemotherapy, a 12-hour surgery. I had numerous surgeries, actually, and then I've had over 50 rounds of radiation, and it's just been, and then since then I've been on some sort of treatment for the last 8 years. So experimental treatment, which is where all the funding that goes to research, goes to benefit me, and all of the money that is given to research labs for neuroblastoma. I'm the one who gets the profit out of that because I get to get all the I get to try the new drugs that they come out with.
In fact, despite my years of intense treatment, my cancer is continually spread, and currently I have cancer in both legs, both knees, both arms, both shoulders, both. I have it all in my lymph nodes. I have it in my kidneys, my liver, my lungs, my lining of my lungs. I have it primary tumors. And I have tumors all over my body right now. Yeah. So, one way I've been able to help these children, though, is through participating in clinical trials. Because I'm an adult, there are promising new treatments available to me that can't be given to these children. As I was the first neuroblastoma patient to receive several of these drugs, and I've been a guinea pig on behalf of these children. I've entered these drugs in order to keep myself alive, but also to help find promising treatments for the children. A few years ago, I was the first patient on a drug that landed me in the hospital for a month with serious side effects called rapamycin. The doctors learned from my experience how to regulate this treatment for children, and now several children are able to take it, but they know the side effects because I was able to show them the side effects.
I guess there's been a lot of my attitude has been great. I just feel like I'm just such a different person. I've had cancer for over a third of my life since I was 17 and all my entire adult life. So I don't really even know in what ways it's changed me because it's all I really can remember. But there's been so many good things that's come out of it. I've gotten to meet such great people through it. It's given me such a purpose to raise money for other children, because really the children who have this neuroblastoma disease don't really have an advocate. They don't have people to speak for them because they're all such young people, and so it's just given me such a purpose to be able to speak for them and just to share the news about this disease that's so deadly. It's such a deadly disease.
I'm standing before you today as a symbol of hope. I'm alive today, able to speak on behalf of these children as a direct result of the sort of research made possible by this event and by these amazing foundations. You guys were the ones who first funded a way for doctors to even distinguish between the different degrees of severity. When I was hospitalized in experimental treatment, I thought, better that I suffer than these little ones. But this setback for me was a step forward for the children. Join with me as we imagine a day when those charts showed nothing at the end and everyone is cured of cancer. Thank you to the William Guy Forbeck Research Foundation for having me here today. It is so encouraging to me that you guys were all willing to come out. And I hope to have just given you some sense of just how crucial your contributions are to the lives of those little children. To so many children suffering, your support means a hope for the future. But for me, it literally means life today.
survivor to wear these pins so that everyone can recognize how many survivors we are surrounded by. So that is what we're celebrating tonight.
Great. Thank you.
So what kind of cancer did you get?
We just saw it rhabdo, because it was like a mouthful.
Yeah, you've got that really long one, right?
Yeah.
It was like 10 letters.
Yeah, it was like the tissue in my ear.
Where was it?
In my ear.
What's the best thing about not being sick?
I could play.
You get to play. What's your favorite thing to do? Football? What do you think about all the doctors that helped you?
I think it was fun.
It was fun and cool. What they helped you? That's pretty good.
In college, took a very inspirational course in cancer biology, and it matches well with my love of children and just love of being around children.
One thing I have learned working with children with neuroblastoma is the fact that it's almost like they compress a lifetimes of activity into a short period of time. They are the most special kids that you can ever think about. And I remember I've got some tape recordings of children who describe and talk about dying in a most incredibly adult way that you can think of. Just very, very special.
The challenges are when children die of their disease and being with their families and wishing that we had more therapies to offer them. I think those are some of the more challenging times.
In the 12 years that I've done neuroblastoma research, I'd never actually seen a baby with 4S disease until several months ago. At the Dana-Farber, one of my colleagues took me to the clinic, and I got to talk with the parents and see these darling babies that are, these two little girls that had received their treatment in the right time, that they were able to bring them back from the disease. So it was an amazing experience. But otherwise, I don't usually meet the patients. It's really hard for me to sit and look through the chart of what the patients have been through.
I am a pediatric oncologist who in the laboratory works on neuroblastoma, which is the tumor that Billy Guy Forbeck had. And then as a physician, I take care of children who have brain tumors for the most part. In terms of my interest in neuroblastoma, it's probably one of the most interesting cancers when people start to really learn about it. It has the highest rate of spontaneous regression of any cancer on one hand, and on the other hand is incredibly aggressive. And many of the children we care for, unfortunately, despite very intense therapy, will still die of the disease.
The study of neuroblastoma is a huge multi-institutional, multi-country activity, but we've played a really significant part in that in terms of making sure that people can talk the same language about the disease. When I first started working on it, for example, people didn't have a uniform staging process, so maybe people were getting good results in one country because they were treating patients that were actually not really had quite such advanced disease as in others. These days, that's all gone away. There's a uniform staging, and that means that people can compare therapists from country to country, from study to study.
I think that it's going to be very important to have international collaborations. We have to communicate about what treatments are being tested so that we don't duplicate efforts. And if we're smart about this, we can share results in a way and be able to compare our results so that we can leapfrog our efforts. Targeted therapy is going to be critical to improving the survival rates in the high-risk neuroblastoma patients.
I think that it's been very special to me to realize that I'm part of a group that really started because of a child who had neuroblastoma, and hearing the Forbecks talk about their experience and the progress that's been made, and knowing that some of the things that are now part of our standard of care came out of this meeting. I think that's really an exciting, really gratifying experience.
Well, I know that there are a number of diseases where the survival rates are improved, but I also know that for high-risk neuroblastoma and other diseases, brain tumors, and some high-risk leukemias, that we still have a lot of work to do.
I thought this has been a fantastic experience, a fantastic meeting, just to be able to interact with some of the leaders in our field, talk to them on a one-on-one level, get career advice, meet other people who are approaching cancer in a very different way than the way I approach cancer, and trying to build collaboration and getting ideas. I go home from these meetings really excited about the research that I'm doing, really excited about learning about other fields and getting back to the lab.
Just look at what's happened in the last 30 years. You know, we've made a small amount of progress. And that progress means that there are some children alive today that they wouldn't have been alive 30 years ago. And yet it's not good enough, because there's still 60% of the children who are diagnosed with the disease will die within 5 years. If there's ever a driver to make people get involved, it's that statement that we are getting there, but we're not getting there fast enough. We need to do more, and we need to find better ways of actually doing that. And it has to be a collaboration, and it's all the way through from the people who even give the smallest amount of money, through the scientists who try to do the work, through the clinicians who are working in the hospital, to the drug companies who are spending humongous amounts of money to actually try and develop new drugs for all sorts of diseases. No one group can actually do it on their own.